Hi, medical class. Today I'm so happy to join you here. My name is Mukhtar Umar. I'm assistant professor of English language. I will join you here in this course, English language, our course, mainly about reading passages, but reading passages related to medical field. Yes, medical field. Before we start, all of you, in previous lecture, we had discussion about the history of patients. We discussed how to understand and how to analyze the history of patients, especially who suffering from many diseases. Okay, we use past simple tense in terms of grammar to write a report about his situations, yes, and to link the previous situation with the present situations. Yes, in the present situation we use future and we use present simple to talk about the facts, yes. So here we have, before we start, we have an objectives, we want to achieve them, yes. In reading passages, we want to develop our abilities in how to analyze languages related to patients, examinations, medical vocabulary, yes, like examinations, like viewing, like telescope, microscope, like assessment, like severe, like diagnosis, like assessment, like past history, like symptoms, like syndromes. All patients were related to it. Yes, we want to develop ourselves in this area, especially for you. You need a vocabulary that will be essential and important for you to learn in the future and right now. So our topic mainly about reading and writing, but how to develop these skills in it. Firstly, we start with the reading. Reading, we read a medical passage. In this medical passage, we want to develop vocabulary. At least we identify, yes, mean recognizing, finding, getting 15 medical terms related to patients, examinations, related to course of nursing. Yes, because nursing and nurse always are caring about patients. Therefore, we want from these reading passages to understand how nurse deal or communicate with patient. In skills of speaking, after reading, we need to develop the conversations between nurse and patients. How the conversations will be. But before this, we read the medical passage, this medical passage, and then we develop into loud discussions and then to the presentations so as to develop our skills in speaking and presentations. Yes, we have objectives, we want to achieve them. Yes, the objectives mean the goal. Why I have to make a conversation with a patient? Because in future, all of you are going to work in clinic, in hospital, in camp, whatever places you are going to join or to involve with patients. Therefore, you needed techniques and skills. These techniques and skills because you work with the community. Someone who works with the community, actually, he needs skills and knowledge in this area. The course here give you this knowledge and skills. Okay, so I'm going to introduce the main idea of the topic, and the title of the topic will be about reading passage related to patience. And finally, we want to develop vocabulary so as to help us whether to write or to speak or to listening the conversations. When we have much vocabulary while we are reading, just we are going to develop our abilities, because these skills of reading automatically we change to speaking by having a discussions, by presentations. But before this, at least we have to develop two things: vocabulary, so as to help us, and we develop grammar. We see the passage if written in past, we have to develop abilities in the past features. If in presence, we are going to use grammar of present times. So here, the passage about patients and nurse. Uh, the care, nurse are always care about patients. This is very essential part so as to give them a good lifestyle so as to recover, and by having a good following and observations from his situations and conditions enable the patients to recover soon. Why? Because having a good conversation with the patients